Hi, steroids are used for a variety of skin conditions. Okay, we give oral steroids as well as topical steroids. So steroid creams are widely used in a number of skin diseases and they're also very effective. But when you use the steroid cream for a long time on your face, unsupervised, without a prescription or without consulting a dermatologist, then it can lead to side effects. In this video, I'll be telling you what are the side effects that can occur after using topical steroid cream and also how you can tackle it. I make videos on skincare and on hair transplantation. If such content is of interest to you, then please subscribe to the channel. There are a variety of creams which contain steroids, so I'll not be able to name everything, but I would request you to check the content of your fairness cream. Always read the contents properly. In the description box below, I'll be writing down the name of steroids. Okay, so if that ingredient is there in the cream that you're using on your face, then please avoid using that cream. Commonly used brands are betamethasone, betamethasone N and GM, Skin Light Cream, Lobate Cream and tenovate cream. Skin Light Cream is a triple combination cream. It contains hydroquinone, tretinoin and mometasone. Okay, so it is used for melasma, but it has to be used for a maximum period for about 8 weeks, not longer than that. If you use it irregularly for more than 2 months, then it can cause thinning of the skin and also lead to rebound darkening of the skin. Okay, so make sure that whenever you're using Skin Light Cream or any kind of triple combination cream for melasma, you always consult your dermatologist and understand how you're supposed to use it, for how long you're supposed to use it, and just strictly adhere to the instructions and do not use it on your own without the proper instructions and consultation with a dermatologist. So what are the side effects of steroid creams? Whenever you use these topical steroids on your face, you will notice that your skin has become thin. There will be increased visibility of blood vessels from under the skin, so it will also appear red. So like the cheeks, the apple of your cheeks tend to appear more red than usual. It also leads to skin lightening, and then it can also lead to increased facial hair. So you will start noticing that the sides of the face where you never had hair, you're starting to notice thin fine hair in that area. Also, it can lead to a lot of acne eruptions. You notice that there are red bumps on your cheeks along with whiteheads. Okay, so you get a lot of whiteheads and red bumps on your cheeks when you use topical steroid creams for a long time. And when you stop using this cream, suddenly you'll notice that your skin tends to look much darker than what it was before you started out. Okay, so this just gives a temporary fairness. So when you stop using the cream, it'll make it more dark and also make it very itchy, and you'll have a lot of burning sensation on your face, like somebody has put chili powder on your skin. Okay, so that's why again you tend to go back to using the cream. So please make sure that once you stop the cream, you stick by it, stick through the entire process. It is very difficult initially, but it does get better with time. If you have severe reactions, then I would suggest you to visit a dermatologist. She will be able to guide you exactly how to go about it, what tablets you can take in order to reduce the side effects. So how long will it take for you to completely recover from the side effects of applying steroid cream? It depends upon how long you've used the cream and also what are the side effects that have developed. Okay, so usually we say it takes about 3 months to 1 year for your skin to come back to normal. So the process is very, very slow. Okay, so it does come back to normal. So you have to be very diligent and religious with treatment. It is not something that you can see easily, and also it is not a very quick response. And also because once you stop using the cream, you'll start looking dull and darker. You always are very tempted to go back to using the cream, but remember that it is just going to ruin your skin in the long run. You have to stick to the regime that has been given to you, and please don't go back to using the steroid cream again. So what can you do if you have side effects to steroids? First and foremost, you have to stop using the cream. Okay, and secondly, you'll have to start using a plain, bland, fragrance-free, colorless moisturizer. Okay, so use any moisturizer which does not have any fragrance or color in it. This is least likely to irritate your skin. Then you have to use a plain zinc oxide sunscreen. Make sure that this sunscreen does not have any chemical component, so it should be a pure physical sunscreen which has either zinc oxide or titanium dioxide in it. Okay, no other ingredient should be there because that can also again irritate your skin and make it appear more red. In spite of applying the sunscreen regularly, remember to stay away from the sun as much as possible. You're supposed to use the sunscreen even when you're indoors, and cover your face or take an umbrella whenever you are out in the sun. The more you stay away from the sun, the faster the recovery will be and the lesser the rebound darkening will be. Okay, so you have to really be careful about using a sunscreen and avoiding the sun as much as possible. A vitamin C and zinc supplement. Vitamin C is an antioxidant. It also helps in lightening the skin. So take that every day for a period of about 3 to 6 months. Take zinc supplements twice a day for about 3 to 6 months. Okay, zinc improves your immunity. So because you applied a topical steroid on your face, you have a higher tendency to develop bacterial infection, fungal infection, even mite infestation. Okay, so zinc helps in kind of boosting your immunity. So you can take zinc tablets twice a day. If after doing all this you do not see any improvement, then it's best to visit your dermatologist. Or you visit your dermatologist if you have a lot of dryness, a lot of itching and irritation on your skin, and if you develop a lot of red bumps on your face. Okay, if you have pimple eruption, then just using these creams is not going to help. Then we'll have to examine, maybe we'll have to extract the comedones, the whiteheads that are present on your face, that will have to be manually removed, and then the pimples will also have to be treated. So what are the usual medications we give when you have a steroid damaged face? So first we start with an antibiotic with an anti-inflammatory property. Okay, so something like a doxycycline or a minocycline or limecycline is what we prefer to give. So we do not give minocycline if you have darker skin tone or have a tendency to develop a lot of darkening. So then minocycline has to be avoided. So we give this kind of tablet in order to reduce the inflammation that has occurred and also to combat the bacterial infection that could have taken place on the skin. Okay, after this we can also give you a course of antifungal. So that can be just one tablet of fluticasone in order to reduce the fungal overgrowth that could have occurred on your face, and also one tablet of ivermectin. Okay, because of application of steroid creams, it can lead to infestation of mite on your face. So giving a course of ivermectin does help in improvement. Along with this, we'll also add antihistamines such as levocetirizine or even fexofenadine or desloratadine. These have to be taken for a period of about 3 months. This helps in reducing your itching, the burning sensation, and also the redness that you may develop on your face. We also give some anti-inflammatory creams which contain metronidazole and niacinamide. Okay, so a cream such as Metrolin gel or Rosea gel, this will help in reducing the inflammation, reduce the redness and itching, and also the acne eruption that you may have had. Once your skin stops reacting, the redness is reduced and you do not have any kind of itching or burning sensation, then we put you on a very safe skin lightening agent. See, we know why you started using the cream. Okay, that was to get rid of either dark spots on your face or you want to lighten the skin color. So remember that there is no way to completely change the natural color of your skin. There is no safe way to completely change the natural color of your skin, but we can definitely improve the color and also definitely reduce the dark spots. So then we'll put you on some safe skin lightening agents. So certain ingredients in safe skin lightening agents are something like kojic acid or niacinamide, licorice extract or vitamin C. So if you use these creams, then it will help in lightening the skin without causing any side effect. My humble request would be to please do not use any fairness creams that are available over the counter. These usually contain steroids, okay, and they tend to harm your skin in the long run. So always make a habit of reading the ingredients. I always get asked, there's multiple creams and whether they have steroids or not. Please make a habit of reading the label of the creams that you're using on the face, and below in the description box as well as in the pinned comment, I'll be writing down the names of steroids. Okay, so if the cream contains any of these ingredients, then please stop using this immediately. I get a lot of requests to recommend creams and treatment for steroid damaged face, but remember that the treatment is vast and it is long term. It is not something that you can take for just 1 or 2 weeks and it'll go away completely. Also, the treatment depends upon how severe reaction you're developing, what are the side effects that you have developed. Okay, so the treatment protocol depends upon that. So without seeing you in person and examining, it is very tough for me to comment on what tablets you're supposed to take and what creams you're supposed to apply. Okay, so this is just a general guideline which you can follow if you're having trouble. But if you have a lot of reaction on the skin and itching and burning sensation which is just not getting better by using the steps that I've already mentioned, then you have to visit a dermatologist and take a proper prescription condition and be on a proper regime for about 3 to 6 months. I hope you found this video useful. If you like such skin and hair related content, then you can follow me on my Instagram handle Dr. Aanchal MD. I post such skin and hair related content daily. Thank you for watching.